Director General for Health, Dr. Patrick Amoth, and President Council of Economic Advisor, Dr. Ndi, GAO, officials, ladies and gentlemen. Good morning. Thank you. Let me start by sincerely thanking my colleague, CS Prof. Kithure Kindiki, for finding time to be here and also for mobilizing this wonderful team. And thank you so much, our GAO officials, for being here this morning. This is indeed a great demonstration of unity of purpose we share as a government. So, ladies and gentlemen, as you well know, we have had significant progress in the health sector. However, there are some key health outcomes which we have still not yet gotten the appropriate target. I love stories, and so I will tell you a story. So while working in the slums, some of the slums in Nairobi, I worked in Mathare, and I remember taking care of one person living with HIV. That was a widowed woman. Her husband had died from HIV, and she was left with 4 children. And she had developed complications in Mathare. So we had to, support her because she could not do her routine duty, which was washing clothes initially, as she took care of her children. But I remember one day when I sat with her, and she asked me one question, "Daktari, ni dawa nitanunua, ni watoto nitasomesha, ni chakula nitanunua kwa nyumba, ni rent nitalipa, ama nitaenda Kenyatta kuonekana?" And so that really touched me, and that is why we mobilized funds to support her. I also think of a 50-year-old man in the village who has that arthritis of his knee, and he has to rub Kaluma on that knee because he cannot afford to go to a facility and get appropriate services. He is energetic and he can take care of his family, but because of that knee pain, he cannot do that. I'm equally reminded of the patients who are on dialysis, and some of them, have had catastrophic expenditure. I remember even of a man I was seeing in Kenyatta who gathered his title deeds, gave his wife, told her, "Go and sell so that I can be treated." And seeing this man a year later, I wondered how much had he had to part with in order to get treatment. And once he's deprived of all this, then he will lose his life, and leave his wife a widow and children without money. So these are real stories in our country. And with the Kenya Kwanza priority, that is the bottom-up economic transformation agenda, one of the priorities being universal health coverage. It resonates with me, and I believe it resonates with each one of you. Disease can come knocking at anyone's door. It does not know if you are elite or you are not. It can come at any time. And so universal healthcare coverage is critical for us so that each of us as Kenyans can be able to access affordable quality care. Okay? And so with the 4 pillars, one of them was the sustainable health financing mechanism, so that the Ministry of Health has a self-sufficient and autonomy in terms of finances, so that we can always have money and we are not depending on the exchequer for health service delivery. Equally, we'll be having a digital platform, and that would support in efficiency, transparency, and accountability, which is part of our national values. And also, we intend to have improved supply chain of the health products, meaning that madawa yafike mashinani effectively, and we are able to monitor so that each one of us can access the products, and equally the healthcare workers. And so in 2023, the Parliament enacted 4 laws upon which our UHC agenda is anchored: the Primary Health Care Act, the Social Health Insurance Act, Digital Health Act, and Facility Improvement. And we are currently at various stages of implementing these laws so that we can give Kenyans quality, affordable health care. And with regards to the social health insurance, Social Health Authority was formed, which will also be able to address these gaps. So I'd like to congratulate you, as Prof. Kithure Kindiki has said, regarding agriculture. 6.5 million farmers within 2 weeks. Please, let's give ourselves a hand of applause. Congratulations, congratulations. And I ask myself, how much more touching each Kenyan? The 12 million households that our Prof has clearly talked about. And so your support will touch each heart, each Kenyan heart. Yeah? It is indeed a privilege, an honor, an obligation for each one of us if all our people can access quality, affordable care. And so, ladies and gentlemen, all these changes we are making will be meaningless unless Kenyans know about them, number one, and two, take full advantage. The reason we are here today, because of the tremendous work, the tremendous experience, the good connection, the prompt sensitization that you have been able to do down at community level. We really need your expertise. We need to leverage on your platform so that we can sensitize, inform the community about the benefits, because there's a lot going on and they are not informed, so that they can know the benefits, they can register, and they are able to access affordable quality care. At community level, the message has not reached quite well. The coverage is not good. At the higher level, there's a lot of things going on in social media that may change the vision of Kenyans. They will not understand that this is for their benefit. We need you to inform them that SHA is for their benefit. They need to register so that they can access care. So we need you to support us in educating the public on their responsibility, and also for them to register in order to access care. So at this point, the priority, again, is to get all households registered and make contributions in readiness for 1st of October. So we kindly request that you engage through the village elders, chiefs, and community health promoters on SHA rollout. Share the message at every public forum as well, and you can present it in the barazas, funerals, weddings, school events, etc. You know your area, and I believe you'll be able to map out and action. So our target, as has been said, 60% of households, which means 12 million households. And so when you look at households, we expand to around 36 million Kenyans. And we hope we can achieve this by the 1st October. And so, ladies and gentlemen, what I'd like to say as I complete is indeed an honor, a privilege, and an obligation for me and for all of us as Kenyans to bring this home, to ensure that all Kenyans are able to access affordable quality care. And so please be ambassadors for the SHA and UHC, and we can take our country forward by ensuring that all Kenyans are able to access quality, affordable care without facing financial hardship as it is at the moment. So thank you, and God bless you.
I'm persuaded Waziri deserves a bigger round of applause. I think she's really personified the story, something you are able to relate with. And I'm sure each of us has some of those stories. And if we listened to her keenly, we need to try and do the same in our engagements across.